not on the front lines. I listen, and I get to meet a lot of incredible entrepreneurs, innovators, healthcare providers, CIOs, and I think that this privacy, I honestly was so surprised at how pressing this is on a daily basis, staying compliant. And I thought that if we didn't address it, we'd be extremely remiss at this show. So I want to introduce to you Ira Parghi. She's a counsel at Ropes & Gray, who's going to be leading this next session. Thank you very much.
Great. Thank you. We appreciate that we are timed between the coffee and sugary treats on the one hand and the beer and Bavarian pretzels on the other. So I think it's probably an opportune moment for us to shift gears a little bit. We've been talking a lot with people on the entrepreneurial side, and we are now going to talk about compliance, which I know everyone enjoys discussing tremendously. I'm going to start by just introducing myself and my fellow panelists and giving a little bit of context on the issue. Privacy is something that gets talked about a lot. I think in the healthcare space, the conventional healthcare space, we have an idea of what it means. In the digital healthcare space, perhaps a little bit less so. And then we're going to launch into a discussion among the panel members. So my name is Ira Parghi. I'm an attorney in the healthcare group at Ropes & Gray, which is a national and global law firm. We deal with digital health from a variety of perspectives, from a healthcare point of view, data licensing, intellectual property, technology, privacy and data security work. And we're thrilled for the chance to be here and to be sponsors of this event. To my immediate left is Leslie Bottorff, Managing Director for Healthcare with GE Ventures, a venture capital firm. To her left, Joe Bengfort, Chief Information Officer at UCSF. And to his left, Doug Foster, the CEO of DigiSight Technologies. So from this panel, as you can see, we have a variety of perspectives to discuss today on privacy. We have the venture capitalist's point of view, the inside technology expert waging the day-to-day war in a big healthcare provider setting point of view, and finally, the point of view of those who work with providers to help them integrate and launch technology successfully. So I thought I would talk a little bit about privacy in the context of digital health. One of the interesting things about digital health is that there are parts of digital health where it's very clear what the regulatory expectations are, who the regulators are, and more or less what's supposed to be happening. In some other areas, it's much less clear, and you really get the sense that the laws are trying to catch up with a very different mode of healthcare, with different platforms, new kinds of information that really weren't contemplated when all the laws were drafted. So a good example, patient portals and the idea of people emailing back and forth with their providers or setting up communities with other patients with similar health conditions. This wasn't really something that was contemplated 10 or 15 years ago. The idea that companies would be creating technologies that create or receive huge volumes of data, send them up to something called a cloud, send them down to a physician's electronic record, perhaps keep some of that data and do interesting, sophisticated analytical work on it. Again, something that's very new. On the other hand, things like electronic health records, we have a pretty good feel for what the lay of the land is. We know that HIPAA, the federal patient privacy law, governs the use of those records by healthcare providers and payers. If there is a breach of someone's electronic health record, we know that that's governed by HIPAA. If a company does work with a healthcare provider and receives information from them electronically, we know that that's governed by HIPAA. But once we move beyond that world, it's often much more unclear. So against that backdrop, it's interesting to see, for instance, if we look at the world of mobile medical apps, who has jumped into the fray and in what sense. HIPAA, although it has a lot to say about privacy in the course of ordinary healthcare, has fairly little to say about mobile medical apps. because HIPAA is really concerned with information in the hands of a provider or a payer. The FDA is interested in mobile medical apps really from a safety point of view. So it's come up with guidelines that will help us figure out if a particular app is a medical device, and if so, if it's going to fall under the enforcement discretion category, or if it's going to fall under the category of devices that the FDA is really going to look at closely. We also have the Federal Trade Commission, which has said very clearly that it thinks there ought to be stronger rules around mobile medical apps. And it approaches these things from a consumer protection point of view and really focuses on the idea of unfair or deceptive practices. So for instance, we've seen some apps that claim to be able to diagnose melanoma if you send them a picture of your mole. Not surprisingly, the FTC had some concerns about whether that was an appropriate practice. And that's an example of some enforcement activity we've seen in this space. But again, it's really an area where it's often unclear what the rules are and whose rules they are. So with that context, I would love to get started and hear what our fellow panelists have to say. And I thought it would be helpful to perhaps start with Joe, the Chief Information Officer at UCSF, and give us his insider's perspective on really from a privacy and data security point of view, when it comes to digital health, what's happening on the ground.
Thank you very much. Well, I'm CIO at UCSF and responsible for a large number of things. The two things that stand at the two ends of the pole of what we're talking about are, I'm responsible for data warehousing and analytics on one hand, and infrastructure and security on the other hand. One job is all about making data available, accessible, and to allow people to work with it and do analytics with it. And on the other hand, it's about trying to not let them do that, or at least making sure they're doing it in a reasonable way. So it makes for a fairly bipolar situation. I work in a culture that at UCSF is very similar to the culture you'll find in most academic medical centers, maybe to a little lesser extent in general providers, healthcare providers, but still very entrepreneurial, very innovative, very independent. Collaboration is extraordinarily important. None of these things are very, well, they don't exactly align with security. Security feels like it's all about locking things down and making things safe and things of that nature. What I'm finding out in the culture is that it's not, the technology is super important, and I want to, since there's a lot of developers in this crowd, I want to make sure I talk about this a little bit, but the technology is very important, but the culture is equally important. And as you selling into a market like this, you need to actually help with the culture. And what I mean by that is we want to put tools in place that are technically secure, but even once they're technically secure, and you can hang the little sign on your door that says HIPAA compliant, you're also providing features and functionality to end users that's important, but it's, they can hurt themselves with it. They can, if they store something out on a cloud-based collaboration service, might be the most secure service in the world, but the features and functions of the service allow them to share really, well, PHI, social security numbers, any kind of sensitive data, that allow them to share it very, very easily. And what we need are technical controls that help warn a user, hey, I just want to make sure you know what you're about to do. And so they can make a decision, or maybe even say, sorry, you can't do that. That's a very important message that I wanted to get across. This is not only about you getting the technology right, it's about understanding the environment that you're putting products into and helping to provide some controls and communication to the users. Because frankly, that's where most of the issues arise. One of my peer institutions here in the UC system just in the past week has announced a fairly large breach, not huge, but a breach. And it was completely the end user inaction that caused the problem, not a technology thing, and that's most often the case. The other thing I would say to a group like this is the partners that we deal with are, we're as concerned about the security of your internal environment as we are about ours. This is, this may not be the most appropriate thing to say, but it's a lot like dating. The more intimate you get, the more you have to worry about the other person, right? You really do. And it's very much that way. Some of the largest breaches that we've had in the industry have happened through third parties that do business with the first party. So they'll find a weakness into your developer environment, maybe be able to get user ID and passwords for your system administrators who happen to also provide support to me. If they can break into your environment, they're really not that interested in your stuff because you don't carry a lot of PHI around. There's not a lot of value in the data that you're holding. But once they get into my environment, now they're going to make a lot of money. So it's extraordinarily important to us that what you're doing to protect your environment is as strong as what we're doing. I think the last comment I would make here is in terms of your developers, it's the developers in your environment that are influencing or creating the product that you're putting out into the world. And there's some very arcane technical details around exactly how they write code, what communication ports they're using when they have that code communicate externally. That has a great deal to do with how secure your product is and how easily it is to hack. I understand completely that in the innovation cycle that you need to follow, you have to move very, very quickly. And you have to get product out on the market. But if you take some time up front to get your developers really informed on how to iterate a product out there that's secure on the first try, it won't slow you down that much.
Great. Doug, tell us a bit about what your company does and how you come up against privacy and data security issues in your day-to-day work.
Sure. So at DigiSight, what we do is we mobilize diagnostics that are in ophthalmologist office. So there are lots of pieces of capital equipment, large boxes that cost tens of thousands of dollars. And some are simple, some are very complicated. We think that all of them can be put onto a mobile platform. And the reason why we're doing this is that we think that if you make these diagnostics mobile, but also very low cost and easy to use, and also that they generate valid data, that you're facilitating the creation of lots of data. And in ophthalmology, that can mean you're preventing blindness, which is a significant cost to the system. It's a significant condition for the patients and their families and their caregivers. So we think there's a lot of value in these data sets that we're creating. So as it relates to privacy, our technology stack is really the full stack in that our diagnostics, our tests, our data generators at the very top level, they can be patient administered, they can be physician administered. We've done a dozen to date. And then all that data integrates into a back end, which currently is our own database. And then as our database is growing, we're now putting an analytics engine on top of that database to allow you to use that data in a valuable way for the system. So we are dealing with patient data, and we are also working into EMR integration right now. And so privacy and security are critical issues for us. And I think any developer that's dealing with PHI, this is a really important topic to focus on early on in the company's life cycle. I think if you look at a lot of mobile health companies, they typically started with a number of software engineers saying, I can fix that, when in fact they should take a step back and say, assuming I can fix that, what is the environment that that technology is going to be deployed into? Because it is highly regulated, whether it's HIPAA or FDA or FTC, it's really, you're surrounded by all sides by regulatory agencies. So we are HIPAA compliant, but I think similar to what Joe was saying, being HIPAA compliant is something that a lot of companies say, and it's really the ticket into the county fair. If you really want to get on the rides, you have to do a lot more, pay a lot more than simply be HIPAA compliant. And that relates a lot to the technological integration that occurs. So we do work at some major institutions, and if you go to them and they say, well, what are you going to do? You're generating this data. with a patient at home, and then what happens to that? So, oh, you just integrate that data into your server. And they say, oh, well, which server are you going to integrate it into? Oh, you know, the one with the Epic on it and that big one over there. Oh, but you know, we have 3 of those, and some are on this side of the firewall and others are on this side of the firewall. Physicians can access A, but patients can only access B. I mean, it's just, you know, there's this whole jungle within the walls of the provider, and that it can be complicated to navigate. So that's beyond HIPAA. I mean, it's obviously under the subject matter of privacy and security, but it's really beyond HIPAA. So from a developer's perspective, that's a challenge, because if you look at provider institution A, provider institution B and C, they all have different HIPAA or flavors of HIPAA. And they're not just one definition of HIPAA. So as a developer, you have to be prepared and knowledgeable to integrate and to work safely and compliantly within all of those flavors of HIPAA. So it's really more than one law. It's you know, infinite scenarios in terms of environments. But I would say it's again, if you want to be in the fair, that's what you need to do. So it's completely worthwhile to do it. And there's a lot of know-how, and I think that's one of the assets that for mobile health companies that are in the space long enough that they should emphasize that if they've been in it, you know, again, long enough, that they've built up knowledge, they've built up expertise, which is something that a pure startup, a company that just started last week, won't be able to say that they have typically.
Great. Leslie, talk to us from a venture capitalist point of view. What are the privacy and data security issues you and your colleagues are looking at?
Yeah, well, we look quite a bit at digital health companies as well as healthcare IT companies. And of course, you know, I'm with General Electric Ventures, and our business unit has obviously all of these concerns and have for a long time in terms of being in the software business. And so my firm is actually lucky enough to be able to consult with our cybersecurity experts in our divisions to help us evaluate startup companies. And of course, they would not expect, you know, things to be maybe of the level of the General Electric company after a good number of years, but there are certain characteristics that they would look for, and that therefore we would look for in terms of evaluating a company for investments. And these are the same kind of things that if you are thinking you're going to get acquired by one of the big companies at some point with your company, that they're going to look at when they do this. And some of those things has the company built in security from the ground up, from the get-go. And I know as entrepreneurs, like Doug said, you're trying to move as fast as you can, but it will pay in spades if you design in security from the beginning. And if you don't have that expertise in a small company, then you need to, luckily there are readily many consulting firms that can help you with that you can design in from the start into the infrastructure security concerns. But that's just the first step. Then there is the testing. You have to design in testing and validation for your system. And the acquirers and the investors are going to want to know, how was it tested? Was it hardened, so to speak, in terms of vulnerability? And then there is the secure deployment of it, actually operationally, once you're a commercial company. Things like that are going to cost some money in terms of operations for a startup company, like, you know, are there 24/7, you know, eyes on the glass, so to speak? Is there somebody watching the system the whole time so that they can react to some kind of a breach or something going on with security? Then there is, are they following the NIST standards in addition to, you know, HIPAA compliance? Have they built their entire system on the NIST standards, which are industry standards that Joe could probably, you know, speak more to? And then the third thing is, I'd say, you know, what is this system going to be used for? How critical is it? What is it going to be used for? You may even need to, depending upon if you're really, you know, helping a hospital system do procedures, you know, and handle the, you know, the personal data like Joe was talking about, you may need to provide what they call a BAA, a business associates authentication agreement, which means that if the hospital has a certain level of responsibility for security, and if you as a vendor have to actually take on that responsibility and be at the level that they are, and that's a big liability that you would be taking on your company. But for many functions, a hospital system like Joe's is going to say, I'm not even going to think about doing business with you unless you have a BAA. And to get that, you're going to have to go through all of these steps from the get-go, from developing your software. So I think the bottom line is it's be very worthwhile and save you a lot of money, capital, and heartache later, and time, if you get the right consultants in from the start to think about how you're going to build your company with security in mind. And the other point that I would make here is that security for these types of companies is not just an operational function, it's actually a marketing positioning. Because if you screw up and your customers have been breached because of you, that could cost you the company. That you are not only legally liable, you're going to really damage your brand. All the brand things that you built up and your franchise you built up can be really damaged. So you really need to think about that as your entire marketing strategy and how you can actually build into your whole marketing positioning what the good things you've done in terms of security.
Great. Some of you touched on this broadly, but I think it's helpful to pose the question in a very square way to all of you, and whoever wants to jump in, feel free. Is there a particular issue relating to privacy or data security that makes you lose more sleep than any others? And if so, what is it? And do you think there are any solutions that we could work towards for that issue?
Well, I'll start with it. I'm not sure how much it applies to this particular audience. Bring your own device, if you know that term. I lose sleep over bring your own device. It's basically, I come from the corporate world, so I've been at UCSF for 4 years. In the corporate world, we basically said, you come to work, you get a machine, it has all these standards. Don't do this, and this, and then everything's fine. In an institution like ours, bring your own device is just part of the culture. And so I have to find ways of controlling these things. And so that's probably the number one, just because it's hard to establish some degree of control over it. Right. Although I'm coming up with a crafty method as we speak.
Ooh, I might want to find out more about your crafty method. How about you, Doug?
It's a very similar notion to what Joe's talking about what we can't control is what we worry about too. And so, we are a software company. We've developed our own software, but we do use vendors for aspects of our server that is cloud-based, and we sign BAA agreements. We make our contractors sign BAA agreements. But it's a chain, and everyone's liable. And you can control what's in your office really well, and you can check in and audit and so forth. But it's just something that's in the back of your head of what if this vendor for us or for UCSF or whoever it may be, what if they don't do what's right, or if they have a weakness in their system that is able to be penetrated, and then it's you're inside. And so that's something that we think a lot about, and we've taken our security is in excess of what HIPAA certainly recommends, and we work with major institutions that are both pharmaceutical companies that are very concerned about this, as well as provider institutions, and so we've gone through the whole validation process with them, which is extensive paperwork, as well as interviews and questionnaires, and so we feel that we're in good stead, but nonetheless, if you don't really know what's out there in the dark, you worry about it.
The only other comment I would throw out there is you can spend a tremendous amount of money and you can take a lot of capability away from the people that are really delivering to the mission of our institution and harden the environment. And if someone is if they really want in, they'll find a way in. You cannot completely protect yourself, and it's a scary thought. And it's not just for the healthcare space. Think about our infrastructure in the United States. If they really, really want in, they'll find a way. And what you have to do is, it's my dad always told me, the lock on the front door will only keep an honest person out. But you kind of want to make sure that you keep all of them out. You have to invest. You have to prove that you have made a reasonable effort to close as much as you possibly can and then at least you will have avoided huge fines.
Right.
But you're never completely protected.
And I would agree with all that. And one thing that I think I would say for entrepreneurs is sometimes you can't get too over reliant on your partners. Like for instance, if you're using, let's say, Azure or Amazon or whatever as your cloud provider, and they're HIPAA compliant and they're a big player, a lot of firms are relying a lot on, well, they've got it nailed, they're going to protect us. Well, in reality, they are only protecting the infrastructure piece of that. If your code, if your application, if some piece of your product, if one of your vendors, gets put on top of that, forget about it. The bad guys can get right through and go, through the front door, basically. And so this is the problem, that you guys are pointing out of all these different people coming in, and it can, the threat can come from anywhere. And believe me, Amazon and Azure and those guys are not going to be the ones that are liable. It will be your company that will carry that responsibility. And in fact, many of those big players will not even do a BAA. And is some more specialized providers kind of on top of that generally the people that Joe probably have to get the BAA from. So you need to be really careful about what you're assuming some of your vendors, even if they're really big players, are going to provide versus what is on you.
Right. And one of the things we're seeing from regulators is they recognize that everyone works with vendors, and the vendors in turn work with other vendors. And now there's a lot more attention being placed on those relationships. And they're saying, well, show us the agreement you signed with this vendor. Show us how you made sure that your vendor was doing what it was supposed to do under the agreement. Show us how you verified that your vendor was, in fact, training its staff on using your confidential information appropriately. The unfortunate thing, too, at the end of the day is if there's a big incident that occurs at the hands of a hospital or the hospital's contractor's contractor, in the press, it's typically going to be presented as an incident that occurred at the hospital, rightly or wrongly. And all of the reputational and other costs that come with that, certainly from the hospital's point of view, are borne by the hospital. And so it's interesting to hear the same issue touched on by all of you from different perspectives. Well,
I would say, at least, for one hopeful message, because this can feel rather hopeless. 4 years ago, when I first got to UCSF, I was selling and telling and trying to make people aware of this issue. The media has really helped me a tremendous amount. They have sold the issue. Because of these large breaches that have happened. And so now we're at a point of funding and execution, and that's a much better place to be in than we were just 4 or 5 years ago. So I call that hopeful.
Yeah, another comment that I would make is that the consumer businesses, purely consumer, that are not positioning themselves to the medical channel, they actually don't have to be HIPAA compliant. And they can do what they want to do, but the fact is that again, their business is built on trust. And the first time that one of those players has a problem with with an inappropriate use of that data, and that might just be they decide they're going to use it for marketing or or advertising or whatever, and people get offended by that, then that can ruin your brand. And particularly for those who are thinking they're going to go international. In Europe, at least, the sensitivity to privacy issues is way above the United States. In fact, Belgium is suing Facebook right now over issues about location and some of those things. And so in thinking about going international, you have to go figure out what's going on in those geographies and what's even acceptable for people to know.
Yeah, I would just add on to that, that being HIPAA compliant in the US is a great step towards internationalizing your technology. Each country has its own data regulations. Europe is probably the most difficult out there. But when you say that you're HIPAA compliant and you follow the procedures and policies in the United States, for many countries, that's a huge start to where you are. So in terms of being a startup company and a developer, and you are thinking about going outside the US, the HIPAA is not just for the US, it really helps you internationally too, so it's quite a good thing.
Mm-hmm. Great. Well, I want to thank all of you for your insights and your time. Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you guys so much.